Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article Survival and Clinical Outcomes in Surgically Treated Patients with Metastatic Epidural Spinal Cord Compression. Results of the prospective multi-center AO spine study in 142 patients by Michael G. Fellings et al. My name is Dennis Shreve, and I am Professor and Chair of Radiation Oncology at the University of Utah School of Medicine in Salt Lake City. My oncologic specialty is radiation oncology of the central nervous system. Epidural spinal cord compression is relatively rare, but represents an extremely important event in the course of patients with metastatic cancer. It is estimated that fewer than 5% of patients with metastatic cancer develop epidural spinal cord compression and may present with back pain or neurologic symptoms ranging from mild sensory disturbance to frank loss of function. Initial steps are usually taken to institute high-dose corticosteroids and obtain consultation from radiation oncology and/or neurosurgery. It is generally believed that early intervention will lead to a better neurologic outcome. As a corollary, the rapid surgical decompression of spinal cord compression is thought to provide the highest probability of recovery of neurological function with the most rapid recovery from symptoms. Several studies have demonstrated superior neurological outcomes in patients with epidural spinal cord compression treated with initial decompressive surgery followed by radiation therapy compared to those treated with radiotherapy alone. The article by Fellings et al. That accompanies this podcast describes the outcomes in patients with malignant spinal cord compression undergoing surgery as a component of their treatment. Outcomes were measured in terms of observational data, including survival and neurological function. Importantly, patient-reported outcomes, including quality of life measures, were obtained using a battery of standard quality of life surveys. The study was a prospective, multi-institutional observational study. The 9 participating North American institutions were selected based on their size and available expertise in the treatment of epidural spinal cord compression. 142 patients underwent a surgical procedure on study to address epidural spinal cord compression causing intractable pain, neurological dysfunction, or spinal instability. The most common primary cancer diagnoses were lung, kidney, breast, prostate, and unknown primary, which accounted for 12%. Surgical technique was at the discretion of the surgeon and involved a median of 5 and up to 18 vertebral bodies. 121 of the 142 patients received postoperative radiotherapy, although no details are given as to timing and nature of the radiotherapy. Median overall survival time from surgery was 231 days and was dependent on primary tumor diagnosis. Breast cancer patients survived longest with a median of 363 days, and lung cancer patients had the shortest survival with a median of 135 days. Overall survival at 1 year was greater than 25%. Compared to preoperative measures, a higher proportion of patients were ambulatory and free from bowel or bladder dysfunction at all follow-up intervals up to 12 months following surgery. Patient-reported pain scores and lower extremity motor function scores were also improved at follow-up compared to preoperatively. Significant improvements in patient-reported quality of life, measured by the EuroQoL 5 dimensions and Oswestry Disability Index, were demonstrated. The results from the short-form 36 Health Survey version 2 revealed significant improvement in several domains, including general health, emotional well-being, and freedom from pain. This study by Fellings et al. Emphasizes the positive outcomes in patients undergoing a surgical procedure for spinal cord compression. Earlier work by Patchell et al. Demonstrated a superior neurological outcome in patients undergoing surgery for spinal cord compression. The current study underscores the benefits of surgery in providing good neurologic outcomes, but also with regard to improved quality of life based on patient-reported outcomes. Epidural spinal cord compression is an oncologic emergency. Like other medical emergencies, treatment algorithms are likely to improve outcomes and provide for more uniform treatment among institutions, different medical specialists, and across geographic boundaries. A multidisciplinary approach to spinal cord compression is critical in implementation of an optimal treatment algorithm. Members of the multidisciplinary team must share common goals and strategies to achieve these goals. The team involved in initial decision-making must include a surgeon and a radiation oncologist, as well as a medical oncologist. These must be specialists who are fully aware of the need for early intervention that may involve surgical decompression when appropriate, based on clinical presentation, overall health status of the patient, and estimated life expectancy. Patients with epidural spinal cord compression meeting criteria for surgery should be transferred urgently to regional centers with experienced specialists. Postoperative radiotherapy protocols should also be standardized in terms of timing following surgery. Radiotherapy is essential in controlling residual growths or microscopic tumor in the surgical field. Patients should be considered for systemic therapy to consider additional metastatic disease, as well as to further enhance local control of spinal metastases. Patients with spinal cord compression for metastatic cancer should be considered candidates for aggressive multidisciplinary management when appropriate. The optimization of this management requires rapid decision-making and implementation of a treatment plan. Early intervention requires awareness on the part of the patient as well as a medical team of the potential signs and symptoms of epidural spinal cord compression. Early presentation followed by a well-thought-out, evidence-based treatment plan will have the highest probability of the desired outcome, local control of disease, and return of normal function. The work of Fellings et al. Highlights that such outcomes are possible, that most patients tolerate surgery and may enjoy an excellent quality of life following this aggressive approach to epidural spinal cord compression. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.